I'm Paula Nutting, your musculoskeletal specialist. How often when you're doing your assessments on your clients and you get them to do gait and you look and see that they really have poor ankle dorsiflexion and plantar flexion? It's one of those common phenomenon, and I always suggest that we start at the pelvis to make sure that that's stable and mobile, that the sacroiliac joints are moving well. We look at the integrity of the quadriceps, the hamstrings and the calves, both gastrocnemius and soleus, but sometimes it comes down to what's happening with that anatomical stirrup. So what's happening between the tibialis anterior and how it attaches around to the cuneiform, that first cuneiform in the midfoot, and also our perineals, because the perineals actually come along the lateral component, drop in under, and again they attach at that midpoint. So that medial cuboid muscle can get can get really quite stiff because you've got two muscles that are acting and drawing upon it. Once you've loosened off a lot of the other soft tissues, sometimes it's good just to get in and do a good old mobilization, and this is what I'm going to show you right now. You're going to put your hand on the forefoot, so when you have a general movement of that ankle, you want to hold the foot still. My fingers are down around the calcaneum to support the hind foot, and we're just seeing, has he got good movement in that inversion and in eversion? Is one tighter than the other? And with Kev, he's got a little bit more tightness and restriction going into inversion. So I would be probably feeling to see if there's something I can do to mobilize that joint. And it's really quite simple. You just fixate that lower half of the foot, grab hold and gently rock. And it's actually quite a nice feeling. You can come in and do some nasty cross fiber on that cuboid, but I don't particularly, unless I don't really like the client, I wouldn't really do that movement because it is a bit nasty. I would make sure I release through tib and perineals and probably a little bit of tib post as well. But just good some movement going through there. And quite often just 3 or 4 movements, you'll hear a click, and it just seems to allow the internal and external, or inversion and eversion of the foot to feel a lot more cleaner. And then on gait, you'll see that their foot runs through that dorsi and plantar flexion really easily. Super simple technique to use. Your clients will love it. Enjoy that. And I'm Paula Nutting, your musculoskeletal specialist.